Okay, we're going to talk about Ebola today. Um, Ebola continues to be a public health and national security priority. President Obama and his administration continue to take aggressive measures to respond. The United States continues to lead the global response to stop the Ebola outbreak. And here's some facts. If you use antibacterial hand sanitizer, you can cut your risk down. It's not transmitted through the air like the flu. And according to public health authorities, the only way a person can get Ebola is by coming into direct contact with body fluids, such as urine, saliva, feces, vomit, breast milk, semen, or someone who's showing symptoms. If a person is not showing symptoms, then the likelihood of you catching it is slim to none. If a person does not have symptoms, once again, they are not contagious. Um, Here's some facts. What is Ebola? Ebola is a virus, and its symptoms include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, lack of appetite, and abnormal bleeding and bruises. Symptoms may appear from 2 to 21 days after exposure to the Ebola virus, which is 8 to 10 days is the norm. And Ebola is transmitted through direct contact with body fluids, urine, saliva, sweat, vomit. A person may ask a question: can I get Ebola from a person who is infected but does not have any symptoms? And the answer is no. Individuals who are not symptomatic are not contagious. It's the third time I said that. Okay. In March, the World Health Organization reported an outbreak of the Ebola virus disease in the country of Guinea. And additional cases are reported in Nigeria and Senegal, Liberia. The Center for Disease Control in September of 2014 reported the first laboratory confirmed disease of Ebola diagnosed in the United States. And this is a person who traveled from Liberia to Dallas, Texas. And the person passed away October 8, 2014. And 2 health workers at the Texas Presbyterian Hospital also tested positive for Ebola. So, you might say, what is the United States doing? What are we doing here? The United States is identifying patients with a history of travel from West Africa or have come in contact with someone who has actively showed symptoms of Ebola. And we're immediately isolating the patients and consulting local, state, and health departments and getting people tested. What can you do abroad? The United States has a strategy to combat Ebola, and one of the things that the United States is doing now, when someone has tested positive for Ebola, a team like a SWAT team comes in and helps the hospital. They come in and find ways to help the hospital have strategies, in other words, to help the hospital combat the disease and keep it from spreading. The United States officials have also deployed to the West African region other surveillance teams, and they've also submitted deployments to Cote d'Ivoire. The President announced in September a scaled-up response that calls upon the unique capabilities of the military to support civilian-led response. The United States has already committed more than $350 million to the epidemic in West Africa. And there's also a grant program for those who want to submit a grant to to the government. The United States has also, President Obama has also called the world to action during subsequent United Nations got back over. Okay. The CDC is assisting with exit screening and communication efforts in West Africa to prevent sick travelers from leaving the country by planes, and they're testing their temperature, and that's about it. And if you'd like to read more about the efforts, you can go to the Obama's administration response to Ebola. Thank you. This is Dr. Summer Reed.